We'll quickly look at another scale which we actually use to assess patients. All right, this one you are trying to use to assess, how maybe a patient is recovering from a particular condition and all. So this is what is known as a Glasgow Coma Scale. Glasgow Coma Scales. So in Glasgow Coma Scales, you are trying to look at, is the patient opening eyes? All right, are they responding to questions you're asking them? All right, are they able to move their hands according to instructions and all of that? So it's a clinical tool. It's used to assess a person's level of consciousness. Maybe the person had a brain injury, or maybe there was some cases of altered mental status. So you evaluate three components, eye opening, verbal response, motor response. All right, so each they will score you. Do you understand? Each of them they will score you. So this is a score, but I think this one is not indexed, right? This one is very much more. So if the patient is opening their eyes on their own, it's number 4. If you must tell them to open the eye, you give them 3. If they are opening the eye to pain, you stimulate pain, the open eye, you give them 2. If you are doing all of this, there's no response, you give number 1. So about the verbal aspect. All right, if the patient is oriented in time, person and place, you can ask them, where are you? Okay, maybe if they have a spouse, you ask them, who is this? You understand? If they get all of that, give them 5. If they are confused, give 4. If they are now talking some things that are outside of scope, give 3. If they can't even reason, give 2. If there's no response at all, give 1. For motor response, if the patient is obeying command, give 6. If the patient moves to localize pain, give 5. If they flex to withdraw from pain, give 4. If there's abnormal flexion, give 3. If there's abnormal extension, give 2. If there's no response at all, you give 1. So if you score the patient and you're done with the 3 aspects, and you get from 13 towards 15, the injury was mild. If you get 9 to 12, moderate. Anything less than 8, you are dealing with a severe case. So how is it used? It's common in emergency and trauma settings. Help to guide decisions about intubation, neurosurgical intervention, and monitoring. Can be repeated to track changes in neurological status over time. All right. So that's just it for the Glasgow Coma Scale.